infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, results were recently published in a study in the Journal of Clinical Microbiology that show limitations of currently available diagnostic tests for early-stage Lyme disease, and highlight the need for more research toward improved diagnostics and treatments. So joining me today to discuss the study and the findings is Liz Horn, PhD. Dr. Horn is the Principal Investigator with the Lyme Disease Biobank. Dr. Horn, welcome to the show, ma'am.
Thank you so much, and thank you so much for having me.
Now, let's go ahead and start out with a discussion on the symptoms of Lyme disease, since that's a big part of the study. What are the telltale signs, and what are the not-so-typical symptoms?
So that's the challenge with Lyme disease. In early Lyme disease, the symptoms are generally nonspecific. They're nonspecific viral-like signs and symptoms. So you could have a headache, fever, chills, fatigue, myalgias, arthralgias. So they tend to be nonspecific. Now, in about a third of people, they also get a skin lesion called an erythema migrans, which is an annular expanding lesion. It's typically red. Sometimes it has central clearing, but not always. And we often hear it talked about as the classic bullseye, but that's a pretty atypical presentation. And so if you're Googling Lyme disease and you see the picture on Google of the woman with this like target on her lip, that's not likely what it's going to look like. So that makes it really challenging because not everyone has the skin lesion. And even if they do have it, it might be in a place where they can't see it. One of the things that does help with Lyme disease in early disease is these symptoms are often happening in the summer where there's not a lot of cold and flu. So sort of even though you can get Lyme disease year-round, in endemic areas, it's more likely to come on in the spring through the summer. So in some ways that helps, but again, they're pretty nonspecific. And that's really just early disease, but you can have some other additional symptoms if it goes untreated longer, where you can have a seventh cranial nerve palsy, you can get meningitis, you can get Lyme carditis, which can be very, very serious. It's a conduction disorder. And if it's not taken care of, you can actually die from it. And then later stages include neuroborreliosis and Lyme arthritis.
Now, I think we can all agree that Lyme disease is a huge public health issue in this country and elsewhere. And an issue that hasn't helped is the current situation with diagnostic testing. So before we delve into your research, can you give us a little bit of history with the diagnostic testing and the problem that occurs with the test available now for early stage Lyme disease?
Yeah, so with Lyme disease, our current standard for testing is an antibody test. So what that means is when you get exposed to something, and I should have mentioned this before, but Lyme disease is caused by a bacteria. It's Borrelia burgdorferi, and it is transmitted through the bite of infected tick. So it's really, we talk about being ticks and being aware of ticks, but really this is a bacteria that's infecting you. The tick's just the vector. So once the bacteria is inside of you, our bodies will make antibodies to it, but that can take a few weeks. So if you have these early signs and symptoms, you're likely to test negative with our current test because they're waiting for your immune response to develop, and it just may not have developed by the time of testing. It's also, with something like an infectious disease like that's caused by a bacteria, if you can detect it directly, that can be really, really helpful. But the spirochete, the Borrelia, that's the type of bacteria it is, the spirochete doesn't like to hang out in the blood. It goes other places. So if we would take a blood test, look for something by PCR, but we can't always detect it. So part of the reason it's so challenging is the nature of the disease. We're looking at people early. Their antibodies might not have developed, and the spirochete doesn't like to hang out in the blood. So that just makes it challenging to have an accurate diagnostic.
So, talking about the study, you were using samples from the Lyme Disease Biobank, and you were characterizing the samples collected for the biobank. Dr. Horn, can you discuss what you and your colleagues did, and what were the methods?
Sure. So it's kind of interesting because our goal wasn't to really look at testing in Lyme disease. Our goal was to create a sample collection to help researchers develop better diagnostics. And as I mentioned before, there's some current limitations, and we did a lot of due diligence and talked to a lot of experts, and there was a need for more early Lyme disease samples. The CDC has a really important resource called the Lyme Serum Repository, and it's really an important and helpful resource, but it only has serum. And so what we did is we started collecting whole blood, which you can also isolate serum from, and urine. So we were able to have some more sample types. And with our testing, because we're going to give these samples out to researchers, they needed to know what we had. So we tested all of our samples, even our controls. And we took a little bit of a broader enrollment criteria because, as I'd mentioned, not everyone presents with an erythema migrans and early disease. So we collected samples from people presenting in endemic areas with signs and symptoms of early Lyme disease. And so most of them had skin lesions, erythema migrans, but not all of them because we know not everyone has that. So we had a broader inclusion criteria. And then we had to test all of the samples, including the controls, because our research partners needed to know about the collection. So that's how we got to testing this large collection of 550 samples from the East Coast and the Upper Midwest.
And what did you find?
And so what we found is that in early disease, our current diagnostics don't detect a lot of it. So for the people that had erythema migrans, only 29% were positive by our current diagnostic test, which is a 2-tier serology test where you do a first-tier ELISA and then you do a second-tier Western blot if the ELISA is positive. And the other thing that was different in our testing, so that kind of testing is it's called reflexive testing, where if you get a positive on the first one, you test with a second test. With our testing, what we did is we tested everyone with all of the tests, and we even used 2 ELISAs, so we had kind of broader coverage. And even in that situation, only 29% were positive with our test, which is a huge challenge because if you go to a physician that recognizes the signs and symptoms of early Lyme disease, they're likely to be able to identify it and treat you, but the test isn't helping them make the decision. And in fact, for people with erythema migrans, they actually don't recommend testing. So, because it's likely to be negative. And so that really just kind of sums up the challenge for the physician in early Lyme disease. How do you know if they have Lyme disease? When do you test them? Are the tests even helpful? And it gets a little bit circular, but it just really highlights why we need some better diagnostics, which we're hopeful with this resource. And we have more than 50 sample users from industry and academia using it, that we can get to a better test. Excellent.
Let's go ahead and switch to the topic of the Lyme Disease Biobank. Can you talk a little bit about it? What's the purpose? What do you provide?
So we really want to spur research, and we want more people working on Lyme disease because it's a huge problem. And if you look at the maps from the CDC across the years, and they have blue dots for cases, you can just see it's really increasing and it's spreading. Obviously the East Coast, the Upper Midwest, and spots of California are quite endemic, but you can get it anywhere, and people also travel. So I think it's important that we have better tests. And so we created this resource for people to create better diagnostics, but also to understand the disease better. So what we've done is we have aliquots of whole blood, serum, or urine that you can apply for. We have a really robust clinical history and testing history on all the samples. We ask people a lot of questions. We ask them if they, do they recall a tick bite? And a lot of people don't. But if they do, what do they remember about it? How long was the tick attached? We ask a lot of information about symptoms. We ask about their current medications. We ask about their history of Lyme disease and other tick-borne infections. And our endemic controls, they're relatively healthy controls that have had no history of Lyme or other tick-borne infections, but it's possible in an endemic area that they could have been exposed. So we have this really robust clinical information, And then we also test for other tick-borne infections that might be common in those areas. So we test for babesia and anaplasma. And on the East Coast, on Long Island, where we're collecting, there is quite a lot of babesia. And in the upper Midwest, there's a lot of anaplasma. And when we provide samples to our researchers, we provide them blinded. So they don't know which ones are the cases or the controls. And we require them to give information back to us. And then we start breaking the blind and letting them know which ones are the cases, which ones are the controls, giving them the testing information, the clinical information. And we have a large enough collection that we can be very specific types of samples that we give to people with the criteria. And then we've also, for projects earlier in development, we've created something called the unblinded panel. And that's 15 samples where you know exactly what you're getting. You have all the testing data. You have all the clinical data. They're all positive by our current two-tier serology testing. And it's a really great place for investigators to start if they have an idea and they want to see if it might work in Lyme disease, people who are already in Lyme disease, and then people who have other tests and other conditions that are trying to bring that technology into Lyme. And then we're also expanding our sample collections to other tick-borne infections, later stages of Lyme disease, such as Lyme carditis, neuroborreliosis, and really just trying to get a better picture of what's happening and having more samples available to researchers.
So how long has the biobank been around?
So it takes a long time to collect samples. So we actually started collecting in 2014, and we started on Long Island at one clinic, and now we've increased to quite a few more sites. But for this collection, that what we just published, the 550 samples, it was 5 years of sample collection. So we've been around for quite a while, and we're still collecting, and we'll have another set of samples in 2019 that will be available in the next couple months. We're doing the testing now.
So if someone wants to find out more about the Lyme Disease Biobank, where can they go?
So I would say if you go to www.lymebiobank.org, that will direct you to the Bay Area Lyme Foundation's website, and it will direct to the page about the biobank and all of our research.
Very good. And I'll go ahead and link to the study and the website in the show notes when the podcast is published. And I want to thank you, Dr. Liz Horn, for your time and your expertise.
Thank you so much for having me. And I think that, Lyme disease is something that can affect all of us. So I think we just need to be vigilant. We need to look for ticks. Prevention is one of our best weapons against this really challenging disease right now.
Very good. Thank you, ma'am.
Thanks.